Welcome to Magnolia Medical Minutes, your local source for medical advice direct from the experts at Magnolia Regional Health Center in Corinth, Mississippi. I'm your host, Andy Stevens with Super Talk Mississippi Media, and today's special guest is Dr. Leonard Pratt. Thanks for joining us, Dr. Pratt.
Thank you.
Our topic today is going to be prostate cancer. Why is screening so important for that?
Well, prostate cancer screening is important because it's very common and it's associated with significant mortality. In the United States in 2024, there were 299,000 new cases of prostate cancer. A lifetime diagnosis of prostate cancer occurs in about 1 in 6 men. It's also the second leading cause of cancer-related death in men, after lung cancer. Like other cancers, early detection is the key. Often men with prostate cancer have no symptoms of any kind.
So if there are no symptoms sometimes, who should be screened?
Generally, the age of at which we start screening for PSA, or which is the prostatic specific antigen, is age 50 in most men. However, there are men who are at higher risk, including African American men and men who have a family history of prostate cancer. Those men should start being screened between 40 and 45. Again, it should be individualized and it should be between a healthcare provider and the patient as to who should be screened at what time.
So now that we know who should be screened, what are the options for screening?
Well, prostate cancer screening should generally be done by something called the PSA level, and that's the prostatic specific antigen. It's a protein that is made by the prostate gland. However, PSA can certainly be elevated in other conditions besides prostate cancer, such as a prostate gland infected prostatitis, and also in benign prostatic hypertrophy, just enlargement of the prostate in man as they grow older. There are other options that can be further evaluated if the PSA level is elevated, and certainly that could include X-ray or MRI imaging, and it could involve even biopsies of the prostate.
What are the treatment options available?
Well, certainly there's a number of treatment options that are available, and one of those options would just be active surveillance, which would involve following the PSA level over a period of time, either so many months or even on a yearly basis. And in an older man, that may be sufficient and may be the only treatment that's warranted. Other treatments are certainly available, including surgical treatments and non-surgical treatments. And surgical treatments would include an open prostatectomy with removal of the prostate gland, possibly even done laparoscopically, or even nowadays with the robotic intervention therapy. You can certainly consider other treatments, including hormonal treatment and including chemotherapy and immunotherapy as well.
Thanks again for your time, Dr. Pratt.
Thank you, Andy.
Be sure to join us again next time on Magnolia Medical Minutes for your local expert medical advice directly from the doctors at MRHC in Corinth.